This is labor and delivery triage. This will be your first stop. So it doesn't matter if you are a cesarean section or a scheduled induction, this is where you go. So as you can see, we have 9 beds here. In this room, we have 24-hour doctors that is available for you. And find out how your baby's doing. We put a belt on and also monitoring for your baby. The 2 questions that we have is, are we going to admit you or are we going to send you home? So we have this room for you just in case you need it after birth when you need to be watched more, you need to be observed more for extended care. We also utilize this room if you are pregnant and you have some complications that you need to be admitted for. Okay, so this is our recovery room. We have 5 beds here, and this is where you're going to go after surgery, after cesarean section. Your baby's gonna be with you. There's also a warmer that we can fully assess the baby. We have 12 labor and delivery rooms. This is where you will labor and you will deliver. This bed turns into a delivery table. As soon as you get here, we will ask you a few questions, and you're gonna need an IV, just so you have emergency room access and also for electrolytes. We actually have a nurse taking care of the baby. But if, let's say, we can foresee that there is a question as far as the baby needing a higher level of care, we have NICU doctors available here too. So there could be 1 doctor and 2 nurses. There's also a nurse taking care of you here. So, and so we put the baby under the warmer. We quickly dry the baby, wanted to make sure the baby's breathing is okay. And then after that, we put the baby on your chest. We really encourage skin to skin. So your baby's gonna have 3 different bands actually. So the 2 bands is identical to mom's ID, or mom's ID band, and also to 1 person that she really chooses. So that person is allowed to go with the baby in some of the limited area. We take pride in our security system. Bracelet is actually going to alarm if there's a passage that we didn't allow to. We take pride also on our neonatal intensive care unit. We are the largest and the most comprehensive neonatal intensive care in Nevada. And after that, once you are stable, the baby's stable, then you get to go upstairs in maternal infant unit. You will be transferred by either a transporter or your nurse. An elevator just for you and the baby. It's all badge access. This is to prevent the baby from getting exposed to the public. It's only for staff. Right? So this is our mother and baby room. We have 24-hour rooming in. If you have a normal spontaneous vaginal delivery, you will be staying here for 1 to 2 days. If it is a cesarean section, then 2 to 3 days. This is where you're going to recover. We wanted to make sure that you are able to tolerate your meals, and we also do a lot of instructions on baby safe sleep, on feeding. We do baby photography here also, and hearing screening. We also offer a celebration meal where you get to choose, you and your family gets to choose on what meal that you would like, and there are 3 choices, and a lot of patients say it's really good. This is our maternal infant unit. We have 42 beds here, and they're all suites. They have their own bathrooms, and we have nourishment area for families also. If you need sandwiches or drinks, we have it available for you.
Hello and welcome to the Neonatal Intensive Care Unit at Sunrise Children's Hospital. My name is Heidi. I am an RN and I am also the Perinatal Navigator here at Sunrise. I've been here since 1994 and right now I work with moms that are considered at increased risk for babies to go to the NICU at the time of delivery. On admission of your baby to the NICU, there's several different equipment that your baby can be put in. One can be an open warmer, which gives off heat. Your baby could also be what's called in an isolette or an enclosed isolette or incubator. Both give off heat. If your baby is in something that gives off heat, we will monitor the temperature by a probe on the baby's abdomen to make sure that the temperature stays within a normal range. Sunrise Children's Neonatal Intensive Care Unit is a level 3 unit. We have a highly skilled team that is here to care for your baby on admission. We also have neonatologists that are here 24 hours a day. So no matter what time you deliver, day or night, there will be a physician that is specialized in care for your baby at the time of delivery. We care for your baby like they're our own. To get into the unit, you will have to go through security checks before you come in. We want to make sure that the hospital is totally secure so that we ensure the safety of all children that are here. Babies that are in the NICU, the Ronald McDonald Room is available for you. It is a place where you can take a break from the baby's bedside. We have a fully stocked kitchen. There's food for you to eat. Please utilize it if you feel that you need it. There are recliners, there are couches, there is a TV. We also have computers. If you feel you need to use a computer for anything while you're here, please ask volunteers that run this room and we will be glad to help you.
This is our classroom. We do a lot of teachings in this room. We have breastfeeding instructions. We also do discharge instructions where we discuss what are the prevention and warning signs that you need to look for you and the baby. We recommend that you have your car seat certified and also tetanus, diphtheria, pertussis. It will just prevent the baby while you are pregnant. It's actually going to go to the placenta. It will prevent the baby from having respiratory disorders and pneumonia. And we also recommend that you pre-register. You can do it online on Sunrise website. It was just gonna give us information, and if you have questions on insurance, then you have that taken care of. And lastly, I recommend that you know your pediatrician. If you don't have a pediatrician, an obstetrician will also recommend someone for you. This is the end of our tour. Thank you so much for your time with us. Have a safe delivery, strong and healthy baby. We'll see you soon.